Well, I've got 5:35, and I'm going to say it. I hate to hold anybody up, so we'll get it started. And as people join, if more people join us along the way, we can always fill those individuals in. So first of all, I'd like to welcome everybody. I am George Vukotic, Associate Director for the Patient Safety Leadership Program. What we hope to do today is to give you some background information. We have a number of faculty members. We actually have a student, and then we might have one or two people that fall in both of those categories. So you can get a number of different perspectives with everything. And with that, we wanted to start out with a video from our director, our program director. We should have that set up and queued to go. So Artie Raghaven, MD, and she's got a long list of titles if you look at her name, but she's going to pop on and get that going. So can we get the video?
Hello, everyone. Thank you for. My name is Artie.
Can we get the video?
Yes, George.
Hello, everyone. Thank you for joining us today for an introduction to the graduate programs in patient safety leadership at the University of Illinois at Chicago. My name is Arti Raghavan, and I'm the Academic Program Director for the graduate programs in patient safety leadership, and I'm also a physician. I'm sorry I couldn't be with you in person today, but I hope that this overview will give you a flavor of what our programs have to offer. I'd like to start by saying the name of the program is a bit of a misnomer, as the content covers the breadth of both healthcare quality as well as patient safety leadership. As you know, healthcare quality and safety has arrived at the forefront of medicine over the past 15 years. Despite this, there's been a lack of standardization around what it takes to actually be a leader in healthcare quality and safety. More recently, a publication from our faculty group has provided some framework around competencies needed for both novices as well as experts in quality and safety. This need for formal training has also been increasingly recognized by regulatory bodies and healthcare systems leaders, as well as training programs and even patients. The goal of the PSL programs at UIC is to prepare tomorrow's leaders in healthcare quality and safety for the challenges that lie ahead. Our program really is designed for both clinical and non-clinical healthcare professionals, such as nurses, doctors, risk managers, hospital administrators, and even health services researchers. The program is meant to be an interprofessional experience, and our students represent various disciplines in healthcare, including administration, nursing, physicians, PharmDs, etc. Our students also represent diverse healthcare organizations, including healthcare settings like academic hospitals, private practice settings, pharmacies, and government agencies, among them. We're proud to say that our alumni have gone on to senior positions such as chief quality officers, medical directors, deans of colleges, managers of healthcare quality and safety, both in hospital settings as well as in the ambulatory setting. The PSL programs at UIC is one of the oldest programs available in healthcare quality and safety. It was established by many of the thought leaders in this field. It's one of the only 5 programs certified by the Commission on Accreditation of Healthcare Management Education, or CAME, and is housed in the Department of Medical Education at the College of Medicine. The Department of Medical Education is internationally recognized for education, scholarship, and service, and the UIC School of Medicine is one of the largest in the country. We can boast a dedicated, diverse faculty group who mentor patient safety and quality improvement change agents, and they represent nationally many healthcare organizations. We're also one of the more cost-effective programs in this field. We have 2 offerings, the Master of Science in Patient Safety Leadership, as well as the Graduate Certificate in Essentials in Healthcare Safety and Quality. The Graduate Certificate name change is pending approval by the Board of Trustees. Our curriculum emphasizes 3 core principles: the principles of patient safety and quality, leadership and organizational management, as well as teamwork and communication. The master's program is distributed over 9 courses, which is meant to be completed in about 20 to 22 months. This includes a 3-day virtual on-site residency. The graduate certificate program consists of 3 courses, is entirely online, and is completed in about 24 weeks. The master's as well as the certificate program proceed through a process of progression. The introductory courses, courses 1 to 3, are based on patient safety, communication, collaboration, and process improvement. The master's students go on to the immersion courses, which include courses 4 and 5, which are based on organizational leadership and healthcare simulation. The on-site program, which is currently offered virtually, bridges into the application piece of the program, which is courses 6 to 8, which focuses on healthcare research, information technology, economics, policy, and creating change. And all of this is bound together by contribution, which is the capstone project, which has a heavier emphasis in course 9. This is an overview of the curriculum. We're happy to share an exciting addition to the curriculum in the form of a course that's dedicated to quality and process improvement. This new course will offer students access to material from the National Association of Healthcare Quality that will also help them prepare for the NAEQ certifying exam if they choose to take it. Our master's students have successfully completed a wide range of capstone projects that provide for an opportunity for application of the principles that students learn throughout the program. The program is supported by capstone mentors provide support throughout the program. Our faculty group is diverse, and all of them have advanced degrees. They represent healthcare, government, education, and research organizations, and each of them are experts in different domains of healthcare quality and safety. They're extremely devoted to teaching and are engaged with the students, and they focus on patient safety and quality improvement as a discipline in their day-to-day jobs. The programs are offered in an online asynchronous format using discussion boards with an emphasis on collaboration, teamwork, and literature searches. The asynchronous format allows for flexibility and work-life balance while encouraging interaction and intellectual challenges between students. The students also like having very experienced instructors. The program uses Blackboard as a platform, which some of you may be familiar with. Throughout the program, students are supported by a team that includes the program director, instructors, finance and advisors, and all technical support. I hope this gives you an overview of the UIC PSL programs, and I hope you enjoy meeting the rest of the faculty, some of our students and alumni this evening. Please feel free to reach out to me with any questions. My email address will be shared in the chat box below. Thank you all and enjoy the rest of your evening.
Okay, so with that, you have a little bit of an overview of the program from our director, Artie Raghaven. And from here, what we thought we would do is give you a chance to meet some of the faculty members, again, students and some individuals who've been both, to give you a little interpersonal touch on who they are, what they do, what courses they teach. And then at the end of the program, we'll have Sharon, our administrator, give you more details and then also give you the chance to ask questions. So to get us started, I would like to ask Amanda Kunstler to tell us a little bit about herself, what she does, her work, and the courses she teaches. Amanda?
Thank you, George. I want to talk a little bit. I'll have to talk a little bit about myself first and introduce myself, and then I'm going to talk a little bit about human factors, and then I'll talk a little bit about the 2 courses that I teach. Again, my name is Amanda Kunstler, and I've been a registered nurse for over 25 years, and I have worked as a healthcare risk manager for over 14 of those years. And I'm currently a senior risk management specialist at the University of Texas Medical Branch in Galveston, Texas. And I received my bachelor's of nursing, and I hold a certification in risk management and in healthcare quality. I spent about the first half of my nursing profession in various types of bedside nursing, working in acute care settings as a med-surg unit nurse, in the ER as a trauma nurse and a trauma case manager for a while, and even a high school nurse for a little bit of time. And as a healthcare risk manager, I wanted to further my knowledge in industrial safety and how to prevent mishaps. So I obtained my Master's of Science in Human Factors and System Safety from Lund University in Lund, Sweden. And since 2016, I've been a faculty member in the Patient Safety Leadership Master's Program. I've presented my master's thesis work as well as other safety topics for various healthcare groups by presenting oral and poster presentations in local and national and international conferences. Oftentimes, healthcare organizations really have increased their interest in human factors over the last few years. And I really believe that to have a robust safety system, I think the understanding of human factors and systems thinking is imperative really to move us forward in the 21st century. Humans often have been a target as the weakest link in industries, but humans actually are really the greatest strength as they are resilient and adaptable. And it's often the conditions in which humans work that cause the mishap. And I wanted to study human factors and system safety because I believe that it's important to study how industrial systems work. Many of my cohort I studied with were from all over the world and from different industries, from nuclear power, deep mining, shipping, railway, and other transportation industries that were also represented. And these safety critical industries are very vulnerable to the social technical aspects of their processes, and healthcare is just the same. So the safety theories that apply to those industries can also be applied in healthcare. And it's vital that we approach healthcare kind of with a different way of thinking. And the only way to truly change one's thinking is to study the foundations of safety science and study safety theories to have a foundation to hold on to for a person's ideals. If a student understands the aspects of these theories, its purpose, the theories can be applied to any industry. And to me, really learning comes oftentimes from outside sources, and that's really why I like this program. The faculty and the students are from all over the country, and we can learn from each other and help each other in our organizations become better and more resilient. I do teach 402, which is the Error, Science, and Risk in Communication. We study about mishaps and ways of investigating those mishaps with tools and methods of investigations. We also discuss disclosure and the impact to the patient and the employee, as well as various other types of communication as it applies to leadership. I also teach 501, which is Healthcare Simulation, Teams, and Applied Leadership Principles. In this course, we discuss leadership principles such as mindfulness, ethics as it applies to research, and healthcare technologies. We also lead the student through their capstone project by having that 3-day program, whether it's virtual or in person. This program is a concentrated effort to assist the student with their final course product. So thank you for listening, and I love teaching and learning with the students from all over the United States, and I hopefully will be able to get to know some of you.
Thanks, Amanda. Appreciate your sharing your background, your insights. You've done some pretty amazing things, so thank you. Next up, we'd like to give you Sherry Hill-Maverius. And Sherry, give us your background and take it from here.
Thank you. I'll talk a little bit about my background, but more about the program and why I'm so passionate about what is being taught and the outcomes that we've been seeing. So I'm a nurse by education. I am currently working as an Associate Vice President of Quality and Patient Safety in a Western Chicago health system. And that is probably the coolest opportunity to really see patient safety and quality from the front line, and how what we're doing in this program can be directly applied from day one to the front line and to really any healthcare facility or organization that you might be working in. As I said, my background is as a nurse, but I have a PhD in organizational psychology, which you may think is kind of not directly related, but in the end, it really is about how organizations move, accomplish things, and especially when it comes to quality and patient safety, you're working with groups of people trying to influence and lead in a way where you want to role model certain behaviors, and that's certainly among the things that are being taught in this course, in this program. So back again to the program. Right now, I am involved mostly with teaching aspects related to the capstone, and Amanda just mentioned that the capstone is the final product of the course, and a capstone is really just a project that is a real life. You saw some examples, Artie Regeven's slides of completed capstones, but the capstone really is a way to take what you're learning, apply it to generally your work setting, and come up with something that's a real life safety or quality improvement. So one of the things I think that's unique about this course or this program at UIC is the fact that it's very applicable, it's very real world, it's hands-on, and the people who are instructing, as you're going to see, come from all different areas in the realm of quality and safety science. And the interaction that's happening is a collegial interaction between the instructors and the students. So that, to me, because we have small groups of people moving through, is really something that's special about this program. I'm so passionate about it because we're really showing and talking about leading edge science and things that, you know, would help anyone coming into one of these sessions to really have a tool, I guess, a set of tools that they can, again, immediately apply and hopefully become a leader in quality and safety. So in a nutshell, you know, I think that this is one of those programs where it's well worth the investment in time and energy, and the payoff is quite amazing. I still keep in touch with some students. I've been with the program for many years. I forget how many years, maybe 6 or 7, but at any rate, I still keep in touch with some students who've graduated, and they are all leading initiatives in one way or another in their organization, either in leadership positions or even in their, just as part of their jobs. And so there's tremendous value added in what is being done here. And that's all I really have to say, but all the best to you all, and thank you for joining us today.
Thanks, Sherry. Great background. And I have to tell you, I hear from many students when they get to their capstone that Sherry's guidance is invaluable. So thank you, Sherry.
Thank you.
Sure. Up next, we have CJ Wolf. CJ, you want to give us a little bit on your background, what you teach, some of the things you have going on?
Absolutely. I'm fond of the program mainly because I came from UIC. So by schooling, I'm an MD, graduated from UIC College of Medicine. But early in my clinical career, I made a major shift and started working in administration and primarily in revenue cycle, reimbursement, so the economics world, as well as the compliance world of regulations. We all know that healthcare is a highly regulated industry. So I've been working professionally in that space for over 22, 23 years. I've worked for Intermountain Healthcare, MD Anderson Cancer Center, the University of Texas System, and their multiple medical institutions, as well as an international medical device company. So now I spend a lot of my time in a consulting role, doing consulting in the healthcare space, both in economics, reimbursement, as well as in compliance. What I love about the program, if I can maybe make an analogy that, you know, it's a big pot of soup, and the heartiest portion or the heartiest ingredient in there is patient safety and quality improvement, and that's the meat of the program, as it should be. But I teach 503, which is economics, policy, and environment. That soup is cooking in a stew. It's a stew, and it's cooking with other ingredients and other things going on. You know, none of us in the healthcare industry know that quality improvement and patient safety is the only thing going on, even though it might be our passion and many of us are in charge of those programs. It's not the only thing going on in that system or in that hospital or that provider type. So what I love to teach is a little bit from my background of the regulatory environment that all of this has to be done in, the reimbursement environment, that, you know, money just doesn't come for all of this stuff. You have to understand how financial reimbursement works in the healthcare system. And that's what we try to do in the course 503 for economics, policy, and environment. I also am passionate about education and even online education. Many years after I finished medical school, I earned a master's in education degree online myself. So I know what it's like to be an online student, and many of my colleagues do as well in a higher education environment. And I just love it. The best thing about the program, though, to me, is the diversity of the students. Every semester that I teach, I learn something new about some aspect of healthcare, because the students come from diverse backgrounds, diverse professions, you know, and it's so wonderful to learn together. And that's my favorite thing about the program. I hope those that are listening that are considering the program will jump into it, and hopefully I get to meet you as well. So thank you for the time, George.
Sure. Thank you, CJ. Great background. And I have to tell you, the importance of the program CJ teaches with all the changes in regulations and government, everything going on. It's a very important topic, not just course, but some of the things that are covered on a larger scale. So with that, the way they pull the cards or shuffle the deck, they have me up next. So rather than throw the card off, I will give you a little bit of background about myself and my role in the program. So again, I am George Vukotic. I'm Associate Director of the program, and I've been with the program since 2015. Actually, 2012 was when I originally started, so 2012. And I got my background mainly starting out in the military. So I was in the military, and I think at the time they didn't know what to do, so they put me in place of a health services administrator. I wasn't sure what it was or what I was going to do, but I quickly found a passion for the area. It was an opportunity, unlike a lot of the areas of the military where it's very operationally focused on, you know, moving people in places. This was taking care of the people. And so to me, that is one thing that stood out. And then as time went on out in the military as well, they put me in charge of a disaster response team. And that was a very enlightening and interesting experience, because that was quite often going in after a disaster, either natural or man-made, happen, and going in and trying to help individuals from that. So that's how I got started. Like I say, I've been with the program since 2012. I have taught a number of courses, and at this point they have me teaching 2 courses. One is the PSL 404 course, which is organizational leadership. And if you look at healthcare, the importance of leadership is more and more important. It's not just leadership styles, but how to use the knowledge and skills you have and when to do it at the right time. So very enjoyable course. We use a text in that course by some recognized experts, Kouzes and Posner in the leadership field. So very interesting course, very positive feedback from that. In addition, I also teach another course, PSL 504, which is about creating human and organizational change. So if you look at how organizational change happens, or in some cases how it doesn't happen or could happen better, it's a very interesting area. And in that one, we use a text by Bowman and Deal called Reframing Organizations. What that does, it lets us look at a number of different lenses to the course content and brings into play a number of experiences individuals have. So it's great learning experience for me. So when we talk about one of the things you like about the program, I learn a lot myself. You know, just like I said, we have the core text, but as individuals bring in their personal experiences and we apply the models to those personal experiences, it's a great learning experience for me. So those are 2 courses I teach. One of the other things I want to mention is we've also been fortunate to do some webinars. And some of you may be familiar with Julie Morath. She was the principal of a Harvard case study around children's hospital and clinics. So that is one of the case studies we use in the program. And we've actually had Julie live on one of our webinars, which you can find on our website. And she is an advisor to the program as well. So that's one person. Another person that we've had, for example, was Joe Shapiro, and she helped us with taking care of the healthcare providers. So she did a very interesting seminar on that. So it's not just what you learn in the courses, which I think is very important, but also the people we're connected to, the network we have, and a number of other individuals that we allow us to bring real world experiences into what we do. So that's a little bit about my background, what I do. And with that, from here, they have me passing this off to Carrie. Carrie, are you ready to go?
I'm ready to go. Thanks,
All right.
George. So my name is Carrie Gailey. By background, I am a nurse practitioner and have a doctorate in nursing, and also just completed a postdoc. So I know what it's like to go to school and to work. It can be a bit challenging. And both of my projects were in change management. And the last one, my postdoc, was really on building a telemedicine quality infrastructure. As everybody knows, with telemedicine starting to do that is critical in this day and age. Otherwise, in my analogy is, if you don't build it on cement blocks, you build it on Twinkies, and doesn't stand up very well over time. So I have been in healthcare on the clinical side for the past 37 years and have been with UIC for about 7 and have loved and enjoyed the entire journey that I've had here. My current role, after I just left and started consulting and really trying with the goal of trying to help organizations build quality infrastructure for their telehealth programs, because I think it's critical as we reflect upon the pandemic and many people who had to just abruptly switch gears and adopt digital tools and see people a different way, and really didn't have a moment to be able to create that infrastructure that's so important. What are the quality measures? What are the business measures? And what are the safety elements that may be missing? So prior to that, however, though, I spent 10 years at the Cleveland Clinic, and I did the same thing there. I created and co-designed their telehealth program, which expanded across their enterprise in Florida, Ohio, Canada, Abu Dhabi, and London. And really with the understanding is you have to have a quality infrastructure. What does that mean? What does that look like? Because this is a space nationally that we're lacking some guidance. It's pretty much in its infancy, and there's very little measures that are out there specific to telemedicine. There are some redundancies in other areas that have already been built out, but great opportunity. So as we shift a little bit, I had the distinct fortune of becoming a VA quality scholar about in the 2014, 2015. And it was a 2-year fellowship really to learn about quality and safety and performance improvement. So I was able to help co-design the new program that we are bringing in to UIC, and that is the Quality and Performance Improvement Program that Artie alluded to on her video. And really, this is going to be a very interactive course. You're going to be doing a personal performance improvement study on yourself, along with learning some very concrete case studies that I hope that we can walk through and develop and learn from. But obviously, with having strong pulls into improvement science, how do you define a quality gap in development? What are performance literacy in health systems, how to optimize those, how to measure, what are the data analytics you use, how to do a run chart and a control chart, and what's the difference in those. So the goal is really for you to be able, or the student to be able to conduct a quality improvement project once they complete the course. It aligns with the NAEQ principles course, and this is part of the last course in the certificate program, but so that it'll give you a good foundation for those who choose the certificate or those who go on to do the master. And we'll talk a little bit about publication and also presentations nationally or within your organization. So that's the one course I teach. The other course I am very honored, and I have really big shoes to fill, is the 401. It's the introductory course. And I believe, George, that Laura is going to talk about that. So I will never be able to do justice to the course that she's been teaching for years. And I am going to pass it on to her so that you guys get the true scoop.
Great. Thanks so much, Carrie. Hi, everybody. Thank you so much for taking time out of your busy days to join us today so we can tell you about this program. My name's Laura Lee. I have a nursing background, but I really spent the majority of my entire career thinking and doing patient safety and quality. So I'm completely passionate about it. I currently am the Senior Director for High Reliability and Patient Safety at a major healthcare system here in the Mid-Atlantic. I joined that team in November of 2020. And prior to that, I spent my entire career at the Clinical Center at the National Institutes of Health, where I had the really great opportunity and good fortune to apply patient safety science to the clinical research process. So, that I'm very grateful for. But I decided to, and my focus in patient safety is really moving patient safety from a reactive approach to a proactive approach. We do really well right now identifying events that happen, and we do pretty well of coming up with good, strong interventions, and we do okay with pushing those interventions, that organizational learning out. But what we really want to do is start moving our approach to a more proactive role where we're actually designing safety into systems, so we don't even have to worry about these big catastrophes that do and are likely to happen. So that's my focus. But I have had the good fortune again and rare opportunity of sitting on both sides of the lectern in this program. So I was a student and graduated in 2013, and then I came on board to teach 401, and I'll talk a little about that in a minute. But because you probably won't remember all these numbers and all the content of it, but I'm here to tell you why it's a wonderful program to be a student in and then to teach in as well. So I decided to pursue a master's later on in my career, but I didn't want to just get a master's just to have the letters behind my name. I wanted a program that I could literally take the information that I was learning throughout the week and apply it to my work. And so I found this program, and that's exactly what this program does. It is completely grounded in science. It's completely driven by the literature, but what you learn and absorb every week are things that you can immediately apply to the work that you're doing, whether you're a quality and patient safety professional and practitioner in your healthcare system, or you're a clinician. What you will learn is what you can apply and immediately make positive change in your organization. So that was really one of the beauties of the program, which was sort of unexpected for me. The other thing that several of the instructors have mentioned was the interaction with the students. I sort of joined the program thinking I was going to be studying on my own, learning on my own, writing papers, having somebody grade them. Yeah, that happens. But where the learning really occurs is amongst the your fellow classmates. Everybody, and I think Carrie said, it's such a rich and diverse student group in each of the cohorts that I both was in and taught, that you can't help but learn, and you really have an appreciation for how diverse our healthcare system is in the United States. So those are the reasons why I, as a student, thought that the program was really terrific. Learning from each other, really taking that safety science and making it practical and applying it to the work that you do every day. So that's that. So 401. So 401 is sort of the overview survey course, 8 weeks long. Every week we talk about a different patient safety issue. Again, people are just getting used to, although online learning and being online has really changed in the last year or so with the pandemic. But as a student, not only are you being exposed to these issues, and many of you may come having spent years working in patient safety and quality. And one thing that was interesting for me was I was doing all this patient safety work, but I never knew what the scientific basis was for it. And so that's one thing that you'll be able to take when you stand up in front of your board and have to give a presentation. You have the literature just in the front of your brain, and you're able to share that. And that's sort of what 401 does. It provides you with this nice breadth of information. And the other thing in 401, and Carrie will soon find out, we're here to support you. Our role is to get you through this program. And we know that you have really, really, really busy schedules. And we know that sometimes things are going to slip because we're all working professionals ourselves and we have crazy busy jobs. So everybody, all of the faculties really needs to make sure that our students are successful, but especially in 401, because it is a little bit of a shock sometimes if you haven't been back to school in a while or haven't been an online learner. So anyway, I'll stop talking, but please consider the program. It's just stellar.
There you go. And we have another student now, and he's still a student. Jerry, give us some of your insights on how you got here, what you're doing, where you plan on going with it.
Hi, my name is Jerry Maloney. I am a current student. I'm about to start my penultimate course with George. For part of my training as well, doing medical toxicology about 15 years ago. I started off during my fellowship actually doing a lot of medication safety work, which got me interested in patient safety. I currently work for the VA. I've worked for a large public safety net hospital, and also I worked at private hospitals in the past as well. So I've kind of seen the healthcare system from multiple safety. I looked at UIC's program specifically. I took both the CPHQ and the Certified Professional Patient Safety CPPS courses. So I have background with patient safety and quality from both of those. What I really wanted was something that was going to help me as well develop not just foundational knowledge, but leadership skills, which is where I found UIC's course to have the strongest curriculum. There aren't very many graduate degree courses in quality and safety out there to begin with, but UIC's was really one of the few that actually has strong leadership emphasis as well. My goal is to progress in patient safety as well. The VA has a robust quality and safety network, and there's room for growth within that. I've focused most of my efforts on medication safety and interface of HIT and patient safety thus far, and that's what my capstone project is actually going to be about. As far as the classes, I found them to be great. The instructors are excellent. They're very flexible. I will, again, make note when they talk about being flexible with life and full-time work. Last spring, when the pandemic hit, all of us who were in my cohort were all getting hit pretty heavily with additional duties of varying degrees, and the flexibility that the faculty gave us was great, and we were able to particularly the early part of the pandemic, involved in almost daily reshuffling of protocols and responsibilities, and in my case, clinical duties as well. So it's really phenomenal. The group learning has been excellent as well. We learn a lot talking to other people, getting idea from other systems. As I said, it's very interprofessional. I've been in classes with nursing and pharmacy. So good to get as well, because this in the siloed. I've really enjoyed the course. I've found the online learning to be very taking some foundational courses with the CPPS and CPHQ. I've still learned a tremendous amount in this course as well. It helped having a background walking in but the amount of knowledge I've gained here additional to that has been excellent. The support for my capstone so far has been excellent. So I've been very happy with the course. I would very highly recommend it.
Okay, Jerry, thank you. Appreciate it. And I'll catch up with you in class. So thank you very much.
Okay, thanks.
So
All right.
you got it. Okay, so from here, what we'd like to do is get the session back to Sharon Lanza. Sharon is the administrator, and she not only can, but will help you with all the administrative things. They put some posts in the chat to give you some information. And Sharon, why don't you pick it up from here and take us home?
Thank you so much. Hi, everyone. My name is Sharon Lanza, and I'm the program coordinator for the Patient Safety Leadership Program at UIC. I really hope you've enjoyed learning more about the 2 graduate programs that we currently offer. As you've just heard from our distinguished panel, the UIC PSL faculty are nationally recognized experts who operate in many different environments and institutions. They bring a diverse wealth of knowledge to the program. The graduate programs in patient safety leadership are conducted in online classes that are asynchronous and specifically designed for currently working healthcare professionals who want to continue their education and become exemplars in the field. UIC is currently accepting applications for fall 2021, so you can apply anytime, 24 hours a day. And the deadline for this next session is July 15th of 2021. Just to give you a little bit of detail about the differences between the 2 application processes for the, oh, thank you for putting that up. That's my contact info as well. So for the Master of Science application, will require transcripts, a personal statement, resume or CV, 2 letters of recommendation, and if you're an international student, there is an international credential. And then for the certificate application, UIC just requires transcripts, a personal statement, and a resume or CV. So if you have any questions about the program or application process, please don't hesitate to contact me at the email address listed on the slide or give me a call. I'd be more than happy to set up a one-on-one chat with you to go over details or answer questions. And like Abhishek posted earlier, please feel free to follow us on LinkedIn and YouTube for updates and more news and content about patient safety. Thank you so much for taking the time to join us tonight. A special thanks to Abhishek for hosting the Zoom and running the tech for this webinar. We really appreciate it. And I will now hand the floor back to George for a Q&A session if anyone wants to ask questions.
Great, thank you, Sharon. So now it's your time. If you have a question, now's a great time to ask. You have faculty, you have students. If we can't answer it here, we'll find an answer. We'll track Artie down. But here's your time. Feel free to ask questions either online or in the chat. I think you can do it either way, and we'll try to answer what we can. And one that's come up actually quite often is the cohort model. And Sharon, I don't know if you can best answer this, but with the cohort model, if somebody runs into a challenge or gets thrown off, how is switching easy or not?
I know that we've been trying to make it more flexible because of like what Jerry was talking about with COVID and people's, people being real life professionals, obviously you've got to navigate different things. And so with the cohort model, you can usually stop out if you need to, and then we'll try to work you back in or jump you back in. We had someone who we just were able to do that with for the coming session. So we try to be flexible.
Great. Okay. Well, like I say, this is your opportunity to ask. And as the questions come in, that would be great. I might also put out there for the faculty that are here, anything you think good to know. Maybe we didn't cover it in the event here, but if you were in a student's place or potential student's place, any question you would like to know more about or any area you'd like to know more about.
George, this is CJ. So maybe somebody could talk about kind of the flow of the courses. I know it's on the website and, we try to stick to that, but I think there's also some flexibility there too.
I know there is. Sharon, could you handle that one? I know we've done some different things along the way or worked with students to accommodate certain situations. Could you address that one?
Sure. So right now, the way that it's set up, like you referred to on the website, it is like a progression of courses, one after the other. With the newer quality course that Carrie and Artie mentioned, we're hoping to make that a more flexible option, and so it doesn't have to be taken in lockstep. And then we're also hoping that that might be open to people that aren't in this program to have even more diversity, but we're still working on setting that up. Does that answer the question?
Got it.
Yes,
Okay.
okay.
And it looks like we have one from Leslie. And for physician staff who have taken the course, do you have some examples of specific situations where they have applied their training? So again, looking at individuals that have taken courses and examples of them having applied their training. Anybody want to pick this one up?
George, I can comment just the fact that my capstone is actually something coming directly from a work-related quality improvement project. I'm on our medication management committee at my VA, and one of the things that we noticed, we're getting a lot of reports for hypoglycemia for people who are getting IV insulin as part of a hyperkalemia protocol, and the numbers widely varied month to month. And I was wondering if we were missing stuff because most of these patients were dialysis or end-stage renal patients. So we pulled all of the times we used D50 and took a little bit of filtering through, but we realized that there were a lot of times where D50 was given as kind of for rescue hypoglycemia for people who had gotten potassium where there hadn't been any type of patient with safety report filed. So we found that there was a pretty substantial underreporting of that, which we're working into the phase of my capstone where we're implementing this as a formal trigger tool now. But that was something that came right out of work. The idea for capstone came right out of work, and the capstone is going to go back and probably lead to a change in insulin dosing and change in how we're doing our hyperkalemia protocol. So if that helps.
No, I think that's a great example. Thank you very much, Jerry. Great example. Yes. Application.
And I would add that I think one of the things that I can remember just going through the program was just being introduced to human factors and usability, and being able to take that sort of lens back to the work that I'd done that I likely wouldn't have done probably as effectively had I not been introduced to it in the program. And then also had the experience of discussing it with my fellow classmates and see how they applied those sorts of issues at their institutions as well. Got
it. Yeah, good points. All good points. Thank you. Another question that's come up is about how much time is generally required per week. Interesting. So I think that can vary a little bit, but I don't know anybody who has any particular thoughts on time requirements per week, and then tied into it. The question is there tuition? So of course there's tuition. Now how much it is, or if there's tuition reimbursement, that may be another part. But maybe we can start out with some of the faculty members giving a little bit of perspective on how much time is required. And then Sharon, I don't know if you have any thoughts on if there's any kind of tuition reimbursement available. So faculty members, any thoughts on, in general, about how much time a student needs to spend per week in your course?
Well, I do think that in the courses themselves, when you open the syllabus or look at the reading assignments, it will tell you that the reading is a certain amount of hours, usually like 4 or 5 hours of reading of the articles. And then you often have like a discussion board question that you kind of discuss with your cohort. And then at the same time, you're working on your, sometimes you're working on your capstone as well. So I don't know that you can say that it's a certain amount exactly each week, but maybe the other faculty have a different answer, but I would give maybe 10 to 15 hours a week.
I think that's fair. I would say in my courses, depending upon the weeks there are case studies versus not, it's probably about 10 to 12 hours. So yeah, that's what I would say with my courses. Anybody else want to add in as far as a time requirement?
I mean, one nice, from a student's perspective, it is nice that it's asynchronous, and so you can sort of set up your own schedule. So, I mean, typically for an 8-week period, I'll just 401, for example, you have something due on Tuesdays and then something due on Friday or Saturday. So it is work. I mean, it's a rigorous program, and from somebody that graduated from it and now teaches at it, I'm happy that it's rigorous. I mean, there's nothing worse than feeling like you're just, well, maybe I'm an exception, but I don't really want to float through. I want to actually learn something when I'm investing in it and time and money. So it does take work, but like I said, you can time it yourself, and you can, and you are really literally applying what you're learning to work that you know, in real time. So, and I don't know, Dr. Mullen, do you have any, as a current student, how's your sleep doing?
So Laura, I think you bring up a good point about the asynchronous. So one of the nice parts is, you know, you post discussion questions in a discussion board. A student will post their response to that question. And then in my courses, I generally ask a student to respond to 2 other individuals that have posted something. But again, it can be more, I don't want to say at their leisure, but they have a few days in between. So as one student posts, I ask other students, at least 2 other students, to give some feedback on that student's post along with my feedback. And it gives you the flexibility. So again, even if we say it's, you know, 10 hours a week, it's not like it has to be a certain set 10 hours. I have students that work all different hours, all different shifts, and they're able to accommodate. So again, having that week at a time module where a post is required and then some conflicting posts or common posts, they can add to it or add other insights to it. So I think that's a flexibility of asynchronous. So I don't know, anybody else want to add anything to that?
I can add something just again as a current student, although the hours do vary a little bit week by week, and part of it depends on the content and your familiarity with it too, because I've had times where I've had it's been content I've been very familiar with, so it's been a bit easier for me than others. I'd say 10 to 12 hours a week on average is probably a good ballpark. Some weeks it's a little bit less, some weeks it's a little bit more. And there is flexibility if you're running into a lot of stuff going on that week, as long as I think you notify the instructors ahead of time. You can, if you really need to get a little bit of flexibility, although I haven't found it to be overwhelming other than maybe like the beginning of the pandemic, but that was a whole different thing. But in general, it hasn't been anything that's been overwhelming, and the asynchronous model has made it great. I work an evening shift. I come home and I can spend an hour or 2 on work when everybody else is asleep, and yeah, that works great. Knowing when things to do ahead of time helps me plan my week too, and you can look out at the syllabus and pretty much look out on the whole course, look at your schedule and figure out when you're going to do what over the course of the next few weeks. So having that schedule in advance is also very helpful.
Thanks, Jerry. Good point. Very good points. Okay. Sharon, I don't know, do you have any insights on any type of tuition support or anything from that aspect?
Well, the tuition for the master's is approximately $30K for the current year. And then let me look up, $9,500 for the certificate, which is 25% lower than like average national tuition cost. And I know that, Jerry, if you don't mind me saying this, I think that did you use the GI Bill? So if you have like a military background, that is another option.
Got it. Okay.
Yeah. Oh, sorry. Yeah. Yes, I did use a GI Bill, and some places do have tuition assistance as well. At least what I've seen with my last 2 hospitals, there actually seems to be a decent amount of tuition assistance particularly for nursing pursuing graduate degrees from both the last 2 places I've worked.
Got it. Okay. And then Sharon, this might be you again. What is the GRE requirement? So is there a certain GRE score that's required?
I don't believe so. I haven't come across that. I don't know if someone else can speak to that.
I don't think that GRE is a requirement for entry into the program.
Yeah, I haven't seen it anywhere, so
okay,
it should have come up by now,
I
right?
haven't seen it, I just didn't know. So hopefully
Sure.
it answers the question. We don't think there's a GRE requirement, and if there is, Sharon will get it waived for you.
Right. And then I think I can take the next question about someone returning after decades and worrying about online learning. So I was right there. That would be I would be the poster child of that in 2011 when I started the program. And that's one nice thing about 401. First of all, Blackboard has, over the last 10 years, has gotten very much more user friendly. So Blackboard is a pretty good platform. And 401, the first course you take, that's all I think about with the students, and I'm sure Carrie will have the same approach. It's like you've got to just go into the shallow end of the pool and sort of walk out. So don't worry about that. It takes you about 6 weeks to sort of get into a cadence. You not only with going back to school, but also using the being an online platform. But it's totally doable. So don't let that worry be a barrier to the program, because those are totally overcomable. And you've got a lot of support, and both within UIC, but also within the instructor group as well.
Good point. Thank you, Laura. Any other questions? And while we're waiting to see if there's anything else, I'm just going to put it back out there for any of the faculty. Do you have any, final words or final thoughts that anybody, I would just open it up, wants to share?
Consider it. It really did change my career. I was doing fine in my career, but I could then walk out in front of my board, and I had it in my head. I had the science in my head. I had experience. I had a breadth of experience for all the people in my cohort. I just carried that with me every day. So it was just an amazingly good decision on my part, and I have never, ever regretted it for a single moment.
Great, thanks.
One thing I would say is, I think, and I think most of my colleagues would probably agree, that you should never stop learning in your life, right? If you stop learning and stop being an active participant in scholarship, I think you get stagnant, and I think your career can suffer. Not that you have to be 110% every minute of every day, but I think being actively engaged in a formalized program that pushes you, but not pushes you too far, I think it's refreshing. It's energizing to me. And so I love being involved in it because I learn, and I'm hopeful that the students are learning too.
Great point. We do have a comment/question coming in here. I'll read it out, and then whoever thinks they can best answer it. So question is from Rita. It sounds like an amazing program, and I'll be recommending it to others. But considering the certificate program, I have an interest in better applying decades of clinical and some administrative experience to benefiting more than one patient at a time. Who should I speak to about choices/opportunities to contribute to the team? UIC or VA or national group. I'm now 46 years old since graduating medical school, but would like to contribute. I would like to see some evidence-based programs for elders put in practice. My situation is atypical, but I can be reached, and then the person has their email. So I don't know if anybody has a quick answer here, if somebody can follow up online. I'll just put it out there. If anybody has something they can respond to now, that would be great.
Well, we can certainly take that and pass it on to somebody within the program. I'm not sure any of us could necessarily respond now, but that's lovely. And thank you, Rita, for that, because that's just terrific.
Thank you. I guess I was wondering about the certificate program in particular, and I'm sorry, there was a little bit of audio problem, but did she say that or is it designed to be completed in 24 weeks? Is that correct for the certificate program?
That's correct.
Shaking her head, so yeah. Rita,
Okay.
any other questions related to that and the program there?
And I just wanted to maybe to throw something in there is, I think even with that knowledge that you would gain in the certificate program, it doesn't have to be necessary frontline. You can apply the information you've learned and make an impact in many different areas. It doesn't necessarily have to be in the practice realm. It could be in many realms. So I would think more broadly in the foundation you'd receive in the certificate program. And I'm happy to, as I'm sure anybody else is, to discuss, and Artie would be a great person, the opportunities that knowledge would provide you, and so that you are able to meet your goal of making a larger impact, a bigger splash.
Well, thank you very much. Thank you. Yeah, my particular area involves neurology and geriatrics and neurobehavior. And as you probably know, the Hebrew Elder Life Program has some wonderful programs that really decrease the incidence and the complications related to delirium on elders when they're admitted to hospitals. But only a small percent of US hospitals have put these practices into place. So I guess I'm already maybe there's a number of initiatives that are kind of brewing in my mind, but trying to work with similarly minded individuals. I had a great opportunity as a faculty member of UIC to work with a Project Echo team, partnering with, I think, one of the quality improvement groups and the Alzheimer's Association in delivering content to nursing homes during the COVID epidemic. And I have always appreciated working with an interdisciplinary team. And it just, your presentations, your passion remind me how exciting and important this is. So my congratulations to each of you. And I hope to maybe be dialoguing with one or two of you as appropriate. Thank you so much for presenting this.
Thank you, Rita. Appreciate your insights and comments. So with that, we're at time. Sharon, do you want to add anything else to close it out or give your email address or contact information one more time?
Oh, sure. I can drop it in the chat. No problem.
Okay.
And it's also all over the website. And
okay. And then with that, I want to thank everybody for participating. I want to thank our faculty members and students in combination for participating. Actually, again, here's where I learned something. I didn't know all the knowledge that I have now that I did before. So I thank everybody, wish you the best, and hopefully we'll see you in class. Thank you very much and take care.
Thank you.
thanks so much.